So I've been at the Stroke Foundation for a year minus a week now, and I've been absolutely bowled over by the stroke community, the passion and the drive and the enthusiasm of the stroke community. So it's been an amazing journey for me, getting to know people out there in the stroke community, the clinicians, the researchers, carers, family members. So I just want to say a huge thank you to all of you. I've learned a huge deal about um, what it means to have the lived experience of stroke, and I'm working away to improve what we do at the Stroke Foundation in terms of supporting people with lived experience of stroke. And I love this quote from David Bramble, who's one of our patrons, is that strokes don't happen to people, they happen to families. And just talking to people that have had strokes, I think that's absolutely true. So I just want to just talk about a few things tonight. The sort of state of stroke in Australia, a bit about the effect of COVID-19, a quick rundown about the information support that we provide for those of you that aren't familiar with Stroke Foundation, some sort of cool things that are happening right now, and then where we're going into the future. So last year, 2020, we commissioned Deloitte Access Economics to do an economic impact of stroke report. And these are some of the results that I wanted to share with you tonight. So what they found was in Australia today, there's around 445,000 Australians living with stroke, and an estimated 27,000 Australians will have had a stroke for the first time in their lives. So that's not second stroke, that's just people that have had a first stroke. And that equates to one every 19 minutes. Over 8,000 people died from stroke in 2020. And the disturbing fact that was revealed from this study was that although the incidence of stroke is declining in general, those of young Australians, those of working age, the incidence has actually increased. And approximately 24% of new strokes in 2020 were of those under 45 years and under. And that's a huge increase from 2012, which was only 14%. There's a lot of work we need to do in this space to get that number down. And I'm going to talk to you a bit about a program that we're doing in this space a bit later on. Another disturbing statistic is that regional Australians are 17% more likely to suffer from stroke than those in metropolitan areas, with South Australia and Tasmania having the highest number of people experiencing stroke for the first time. The hottest spot is in New South Wales, followed by Barker and Adelaide, which is interesting because Adelaide's obviously a metropolitan area. The good news is that 80% of strokes can be prevented. Obviously, there are strokes that are genetically predisposed, family history, etc. But there is a lot we can do to prevent strokes. And one of those things we can work on is things like improving blood pressure control, cholesterol, diabetes, lifestyle factors such as smoking and alcohol, and diet. The Deloitte Access Economics people did a bit of a study into the cost of stroke, and they worked with us and the wider stroke community to come up with some benchmark treatments that were achievable in the next 5 years, and then looking at the cost of what would be saved if these benchmarks were achieved. So we could save 1.2 billion by improving access and timeliness to treatment, 1.3 billion if we reduced uncontrolled hypertension, and 45 million by increasing the number of antihypertensives prescribed on discharge from a stroke unit. So all very, very doable. But if we do nothing, by 2050, there will be over 800,000 strokes, Australians living with stroke compared to today, and 50,000 new strokes will happen. So big increase in numbers. No sort of talk today would happen without mentioning COVID-19, and it has impacted the stroke community in both indirect and direct ways. So indirectly, people aren't calling 000. They aren't going to see their GPs. They aren't going to see their doctors. And the other indirect impact is when we were sort of suffering the acute lockdowns, particularly in Victoria, the stroke units got repurposed as for COVID wards and rehab services closed. We were very lucky to have rehab via telehealth, but obviously it's not quite the same as face-to-face. So problems there. And then, stroke support groups, community talks stopped. There were obviously some highlights. I think one of the biggest ones is public health awareness in general improved. Telehealth has really kicked off. The work that we do with the stroke living guidelines got translated into COVID guidelines, which that task force is still carrying on. And we have kicked off a national webinar series for health professionals, which is actually allowing us to reach more health professionals than previously with face-to-face activities. I thought this graph was of great interest. We all know that people weren't going to go and see their doctor, and they weren't getting diagnosed with things like cancer. But if you look at the graph of CTs and clot retrievals, you can see when COVID hit, there was a massive drop in CTs for people with stroke and clot retrievals. And we don't know what the long-term impact of that is going to be yet. We're yet to sort of find out what the long-term impact of people not getting diagnosed with strokes. The other thing Stroke Foundation has on the website, and we update quite regularly, is some clear advice around the vaccinations for COVID. So I worked with our consumer council. We have some aphasia experts on the council to develop some really easy to understand guidelines on vaccination. We also had to move our stroke safe talks onto a virtual platform and the training as well, which is something we've never done. And the stroke safe volunteers actually took to the training online really, really well. So it's something that we will continue as well. I just wanted to sort of provide a brief overview of the information and support that we provide at the moment, especially for those that aren't familiar with the work that we do at the Stroke Foundation. I'm sure a lot of you will be familiar with some of this, and some of it might be new. So we have a helpline, which is open 9 to 5 on the Eastern Seaboard side, and mostly inbound, but we do have a continuity of care outbound service. So that's in Tasmania, Queensland, New South Wales, and ACT, and that's all associated with state-based government funding. It's not that we're preferential in any state or the other. This is the key resource that people get when they get discharged from hospital. And My Stroke Journey, it comes in a variety of forms: an easy English form and a classic form, and we've just finished developing one for childhood stroke, which is the purple one there. Due soon to be released is a version for Aboriginal and Torres Strait Islander communities, and we're hoping to launch that towards the end of the second half of this year. Enable Me is our peer-to-peer support platform. There's lots of information resources, podcasts, blogs, chats. It was co-designed with people with lived experience of stroke. So if you haven't popped on there, have a look round. You can sign up and you can get involved with all the chats and just have a deep dive into some of the information that we've got in there. So this is a bit about our family stroke journey. We did a major donor campaign in 2018 to raise funds to resource this, and there was a gap in information for families who had kids who had had a stroke. So we developed that in partnership with some childhood stroke survivors. Another thing that we're doing in the childhood stroke area is a joint research project with the Murdoch Children's Institute, and it's all around getting a protocol for kids that have a stroke and to improve the time to treatment. So we're trying to get, as with adults, there's a code stroke, and we're trying to get the treatment time down to 4.5 hours, which is, as you all know, that in stroke time is brain. I mentioned earlier that the incidence of strokes increasing in young adults, and as a response to that, we've developed the Young Stroke Project, which is a real co-designed, co-developed project with young stroke survivors in across Australia. So we've got a great lived experience working group that work with the team at Stroke Foundation, and one of the staff members is a stroke survivor herself. So it's a great project. I think it's a real how we're going to work moving forward, really. And they've done lots of roundtables, exploring work, and the next big topic is going to be emotion. And these are the gang who are on the lived experience working group. Some of them will be familiar to you. And that's the actual team. So Simone, Bev, and Saran are the team. We now have a girl, Catherine Davis, who's come back from maternity leave, who's also on the team. So the month of May is Australia's biggest blood pressure check month, encouraging people to get their blood pressure checked. Very, very important. Just under half of strokes would be eliminated if blood pressure was controlled better. We've got a bit of information on our website there if you want to hop on and have a look. This year we're partnering with Bloom's the Chemist to deliver blood pressure checks in their pharmacies, but you can obviously pop down to your GP, get your blood pressure checked, check it at home on a validated machine, or pop into any pharmacy really, and they'll get your blood pressure checked. We didn't do Australia's biggest blood pressure check last year because of COVID, but the year before we partnered with Priceline, and we managed to do 418,000 tests, which showed a 13.8% of people tested had high blood pressure, and not unsurprisingly, more of them were men. The women 11 versus 16%. And in Victoria, we partner with Ryman Healthcare, and we have a van that goes around and measures blood pressure. Not last year though, and we're yet to get it going again this year, just given all the COVID ups and downs. I couldn't do a stroke talk without mentioning the fast signs of stroke. So really raising awareness about the fast signs of stroke is absolutely crucial. The faster you can get to hospital, the faster you can have treatment. So the fast signs are: has their face dropped? Can they lift both arms? Is their speech slurred? And then the T is time. Call 000. Don't go down. Don't go and have a lie down. Don't make an appointment with your GP. Call 000.
In Australia, stroke occurs every 19 minutes. When stroke attacks your brain, up to 1.9 million brain cells die every minute. Think fast. F, face. Has their face drooped? A, arms. Can they lift both arms? S, speech. Is their speech slurred or confused? T, time. Call 000. Time is critical. Stroke is always a medical emergency. Act fast. Call 000.
We do surveys every year looking at the awareness of the fast signs, and it's still disappointingly low. a lot of people recognise that stroke's a medical emergency, 82%, but only 16% recognised could name 2 or more signs of stroke, and that was sort of unprompted, so without any hints. And then only 46% could get all 3 signs, and that's prompted. So we do have a lot of work to do. And when you look at non-English speaking households or culturally and linguistically diverse households, that those numbers are even worse. So there's a couple of areas that we're targeting, and we received a federal funding to actually concentrate on some of these areas and develop some TV adverts specifically in 8 languages, which are there, and SBS ran them over a couple of months, and hopefully when we measure the survey again next year, we'll have seen a bit of a pickup in fast awareness. The other thing that's happening this month is the Tau Challenge. So the idea behind this is you wear a towel, cover yourself up properly, take a selfie and post it on social media with the hashtag Tau Challenge. There's also calendars you can buy. So we got lots of Olympic athletes this year to pose in their towels, and it's a real awareness raising, fundraising activity, a bit of fun too. A shout out for National Stroke Week, which is coming up 2nd to 8th of August. If you want to find out more, pop on the Stroke Foundation website. Last year it was all about fast heroes, and similar theme this year. So finally, a bit about the future. Now, normally at Stroke Foundation, we have a kind of 5-year strategic planning cycle, but given the pace of change in healthcare and the world generally at the moment, we've decided to break that down to a 3-year cycle. So we're actually going through a big strategic planning phase at the moment, and we're at the phase of sort of collecting lots of information and deciding, on the strategy for the next 3 years. And this peak study has been a really informative piece of work from the community perspective. And the themes that we've picked up, so this study, we've interviewed a lot of people, we've done workshops with people with lived experience, and these are the things that I've picked up as the key sort of features of the future of stroke from a lived experience perspective. One of them is continuity of care, so that includes navigating the health system once you get discharged from hospital. Another one is the increase in care at home. So the shift from staying in hospital for a long time, getting lots of rehab in hospital, to at home. Person-centric care. So, the person is the center of the care rather than the hospital or the health professional. Co-design, move to digital and data, and using data to inform what we do. Mental health is a big one, and that definitely came through in this study. Work and sort of living the best life that you can after stroke. Clinical trials, once again, more involvement from people with lived experience, their carers, in clinical trials. Individualized information and support. So, not everybody wants to look on a website, not everybody wants peer-to-peer support. So trying to provide the match to the person. And then I hear over and over again that people really value that peer-to-peer support, not just trawling online. So those are the sort of key things that I've picked up and will be feeding into the strategic plan. We haven't quite finished the information gathering stage, but that's where we are so far. Now, another big thing that's happened this year is some funding for the Australian Stroke Alliance. We have CTs in ambulances, but now we want to get the CT scanners flying. So the idea of this is that you can put a mini CT scan in an airplane, in a Royal Flying Doctor airplane. It can reach rural and remote Australia. you have your scan in the airplane, and then you have your clot busting treatment in the airplane. I was listening to somebody speak who'd had clot busting treatment in the ambulance, and it was just an amazing story. He said, I got the thrombolysis, and before I even got to the hospital, I could feel that I could move my arm and my leg again, and that is just an incredible story. So if we could get that technology out into rural and regional Australia, that would be just amazing. And these are just some figures on the achievements of the mobile stroke unit ambulance in Victoria. And there is a mobile stroke unit coming to New South Wales now as well, which is absolutely fantastic.
Stroke is one of Australia's biggest killers. The first 60 minutes after stroke onset are critical. If we can treat during that first golden hour, the likelihood of recovery is much greater.
However, Australians with stroke living in rural and remote locations, particularly Indigenous Australians, have poor access to acute stroke treatments and, as a result, significantly worse health outcomes.
The clock is ticking. If we don't act differently now, by 2050, there'll be a stroke every 4 minutes in this country, and 1 million people living with the impact of stroke in our community. That's a devastating thought.
The first step in closing this gap and allowing really urgent treatment has been the Melbourne Mobile Stroke Unit, which brings the hospital to the patient.
It was just a normal day. I was just in the bathroom, getting myself ready to go to school, and that's when the stroke hit me. My son found me maybe 15, 20 minutes after I may have fallen. The mobile stroke unit arrived. Then they had me downstairs really quickly for the CT scan. I probably owe my life to the mobile stroke unit and the quick treatment I received. We will be forever grateful for that quick treatment.
The mobile stroke unit is delivering fantastic results for those with stroke in metropolitan Melbourne. We now need to do much more, much better for those in remote and rural Australia.
To make stroke treatment truly mobile, we are miniaturising CT scans to enable us to treat at the point of care.
This is exciting because it will allow the development of the world's first stroke air ambulance and stroke-capable standard ambulances to reach regional and remote Australians. It's time to look to the skies.
We are part of a large team that have joined forces to make a difference. We are leading the engineering activity of the new stroke air ambulance together with our clinical colleagues.
Part of the challenge is developing new materials that make the brain scanners more lightweight and then miniaturising the components so that we can fit this all into an aircraft.
Each year, the Royal Flying Doctor Service retrieves hundreds of Australians from rural and remote parts of the country. The exciting thing about this project, working with the engineers, scientists and doctors as part of the Stroke Alliance, is that if we can make that diagnostic equipment smaller, small enough to be packed on a plane and taken to the patient, we'll be able to make that diagnosis sooner, initiate treatment sooner, and as a result, save the lives of rural and remote Australians.
The day-to-day conditions can be trying. I mean, it can be hot. The nearest hospital would be about 500k away. It would be great to have an air stroke ambulance out here so that we could have similar services to the metro area. It would be just unbelievable. It would be great.
Stroke isn't talked about in the Indigenous community a lot. I think I was around 30 when I had my first stroke, and I worked 3 days prior before I even realised that I had a stroke. When I did see a doctor, I was transferred on to our district hospital. I waited 23 hours before I could get a diagnosis. Better awareness would be really good around the rural and remote communities, and quicker access would benefit them in a huge way.
With the mobile stroke unit providing exceptional care for stroke patients in metropolitan Melbourne, the Royal Flying Doctor Service providing stroke care for those in remote and rural Australia, our air ambulance helicopters will bridge the gap, providing world-class stroke care faster than ever before.
This is a unique opportunity to develop a national standard for stroke care that will reach all Australians and transform care as we know it in Australia.
We are proud to be leading this mission.
And that's why we're asking all Australians to join us in this once-in-a-generation initiative.
To transform stroke treatment.
To deliver the best care.
To build a better future.
For all Australians. We're with you.
We're with you.
We're with you.
We're with you.
So that project is a real goosebump project. Received $40 million from the Australian government, which is the biggest research grant received in Australia. So absolutely fantastic to be part of that and incredibly exciting. I just wanted to pop this final slide up because it was a pledge to one of our lived experience group that I would get this slide organized because one of the working groups that I'd been in had really sort of stirred up some of the emotions of people who had been through their stroke journey, even 10, 15 years ago. And I would just want to thank AID for the little nudge to get that going. So I'm happy to take questions. I'll just stop sharing.